Insomnia is a common sleep disorder that significantly impacts a person's ability to fall asleep, stay asleep, or achieve restful sleep, even when they have the opportunity to do so. It is not merely occasional sleeplessness but a persistent condition that can interfere with daytime functioning, mental health, physical health, and overall quality of life. Types of insomnia. Insomnia can be classified in several ways, primarily by duration and cause. Acute insomnia, this is short-term insomnia, often lasting for a few days to a few weeks. It usually arises due to stress, a traumatic event, or lifestyle disruptions such as jet lag or shift work. Chronic insomnia, when sleep difficulties occur at least 3 nights per week for 3 months or more, it is classified as chronic. This type often has complex causes and may require medical attention and long-term management. Primary insomnia, this refers to insomnia that is not directly associated with any other health condition or problem. Secondary insomnia, this occurs as a symptom of another issue, such as depression, anxiety, chronic pain, medications, or substance use. Causes of insomnia. Insomnia can stem from a wide variety of factors. Psychological issues, stress, anxiety, and depression are leading causes. Worries about work, school, relationships, or financial troubles can keep the mind overly active at night. Medical conditions, chronic pain, asthma, diabetes, acid reflux, cancer, Parkinson's disease, and Alzheimer's disease may all contribute to sleep problems. Lifestyle factors, irregular sleep schedules, late-night screen time, excessive caffeine or alcohol intake, and lack of physical activity can disrupt sleep patterns. Medications, certain prescriptions like antidepressants, blood pressure drugs, allergy medications, and stimulants may interfere with sleep. Environmental factors, noisy surroundings, uncomfortable bedding, temperature extremes, or changes in sleeping location can also trigger insomnia. Symptoms of insomnia. The key symptoms of insomnia include difficulty falling asleep, waking up frequently during the night, waking up too early and not being able to return to sleep, feeling tired or unrested upon waking, daytime fatigue or sleepiness, difficulty concentrating, remembering, or focusing, irritability, mood swings, or depression, decreased performance at work or school. These symptoms can affect personal, professional, and social life significantly. Effects on health. Insomnia is more than a sleep issue. It can lead to serious health complications if left untreated. Prolonged sleep deprivation weakens the immune system, increases the risk of high blood pressure, heart disease, obesity, and type 2 diabetes. It also elevates the risk of mental health disorders like anxiety and depression. Long-term insomnia can impair cognitive function, memory, and decision-making ability, and in some cases, increase the likelihood of accidents due to decreased alertness. Diagnosis. A diagnosis of insomnia is often made based on a person's sleep history and patterns. Doctors may ask patients to keep a sleep diary, detailing sleep and wake times, naps, and sleep quality. Questionnaires and sleep assessments help identify causes. In some cases, a polysomnography, overnight sleep study, or actigraphy, a wrist-worn device that measures activity, may be used to analyze sleep behavior more thoroughly. Treatment and management. Treatment for insomnia depends on its underlying causes and severity. Common approaches include cognitive behavioral therapy for insomnia, CBTI. This is the most effective long-term treatment. It helps people identify and change thoughts and behaviors that interfere with sleep. CBTI may include stimulus control, sleep restriction, and relaxation techniques. Medications, sleep aids or sedatives may be prescribed for short-term relief. These include benzodiazepines, non-benzodiazepine hypnotics, and melatonin receptor agonists. However, long-term use is discouraged due to dependency risks. Lifestyle modifications. Establishing a regular sleep schedule. Avoiding caffeine, nicotine, and alcohol before bed. Creating a relaxing bedtime routine. Making the sleep environment dark, quiet, and cool. Reducing screen time before bed. Alternative therapies. Some people find relief through yoga, meditation, aromatherapy, or acupuncture. Prevention. Although not all cases of insomnia can be prevented, certain steps can minimize the risk. Maintain a consistent sleep routine. Avoid stimulating activities before bed. Exercise regularly, but not too close to bedtime. Limit naps during the day. Learn and practice stress management techniques. Conclusion. Insomnia is a serious, yet often overlooked health condition that affects millions worldwide. While it may seem like a simple inconvenience, the long-term consequences can be significant if not addressed. The good news is that with proper treatment, lifestyle adjustments, and support, most people with insomnia can restore healthy sleep patterns and greatly improve their quality of life.